Hello, my name is Dr. Dewan S. Raja. Today I will discuss multiple choice questions on chemotherapy. I'll put emphasis on the history of chemotherapy, mode of action of the chemotherapy, and the adverse effects of chemotherapy. Let's start with number 1. A 25-year-old soldier presents with symptoms of hostile gas exposure during combat operation in World War I. He complained of persistent cough, shortness of breath, and skin lesions. Upon examination, there are signs of respiratory distress and skin blistering. What substance widely used during World War I is responsible for the patient's symptoms, and how did its accidental discovery contribute to the history of chemotherapy? These are the choices: penicillin, mustard gas, aspirin, chloroquine, insulin. What is that substance widely used during World War I, responsible for patient symptoms like this? How did its accidental discovery contribute to the history of chemotherapy? Answer is mustard gas. B is the answer. Mustard gas. Question number 2. A 35-year-old male patient is undergoing chemotherapy for testicular cancer. He has been receiving cisplatin-based chemotherapy. He presents with complaints of persistent nausea, vomiting, and hearing impairment. Which adverse effect is most likely associated with cisplatin-based chemotherapy? A. Peripheral neuropathy. B. Visual loss. C. Pulmonary fibrosis. D. Cardiotoxicity. E. Ototoxicity. So, what is the most likely adverse effect associated with cisplatin chemotherapy? Answer is E. Ototoxicity. This is the answer. Ototoxicity. Question number 3. A 35-year-old man has been diagnosed with testicular cancer and is about to start chemotherapy. Concerned about potential hair loss, he discusses preventive measures with his oncologist. What preventive measure can be recommended to minimize or prevent chemotherapy-induced alopecia in this patient? A. Scalp cooling, cold cap. B. Topical corticosteroids. C. Increase hydration. D. High dose vitamin supplementation. E. Phototherapy. So, what is the right choice? Answer is scalp cooling, cold cap. Scalp cooling, cold cap. Question number 4. A 60-year-old man is diagnosed with a rapidly dividing colorectal cancer. The oncologist is considering targeting nucleotide synthesis pathways as part of the treatment plan. Which enzyme is targeted by anti-metabolite like methotrexate for inhibiting de novo nucleotide synthesis in cancer cells? A. RNA polymerase. B. DNA polymerase. C. Thymidine kinase. D. Ribonucleotide reductase. E. Carboxylasterase. What is the correct answer? Correct answer is ribonucleotide reductase. This is the correct answer. Ribonucleotide reductase. Question number 5. A 40-year-old woman with breast cancer is undergoing chemotherapy. The treatment plan includes a drug that induces cell cycle arrest in cancer cells. Which class of drugs commonly induces cell cycle arrest in G1 phase? A. Tyrosine kinase inhibitors. B. Topoisomerase inhibitors. C. Anti-metabolites. D. Cyclin-dependent kinase inhibitors. Okay, so which drugs commonly induces cell cycle arrest in G1 phase? Answer is D. Number 5, answer is D. Cyclin-dependent kinase inhibitor. Cyclin-dependent kinase inhibitors. D is the answer. Question number 6. A 25-year-old male is diagnosed with Hodgkin's lymphoma and is scheduled to receive chemotherapy. The oncologist plans to include vinblastine in the treatment regimen. What is the primary mechanism of action of vinca alkaloid like vinblastine in the treatment of lymphomas, and how does it impact cancer cells? A. Inhibition of DNA synthesis, blocking the action of topoisomerase. B. Disruption of microtubule formation, inhibiting cell division. C. Induction of DNA cross-linking, interfering with DNA replication. D. Stimulation of apoptosis, triggering programmed cell death. E. Inhibition of inflammation, triggering production of specific proteins. So, regarding vinblastine, what is the primary mechanism of action? Number 6. This is the action of vinblastine. B. Disruption of microtubule formation, inhibiting cell division. B is the answer for vinblastine. Disruption of microtubule formation, inhibiting cell division. Question number 7. A 45-year-old woman with breast cancer is scheduled for chemotherapy. The oncologist plans to include doxorubicin and anthracycline in the treatment protocol. What is the primary mechanism of action of anthracycline like doxorubicin, and how does it impact cancer cells? A. Inhibition of DNA synthesis, blocking the action of topoisomerase. B. Disruption of microtubule formation, inhibiting cell cycle. C. Generation of free radicals and intercalation of DNA, causing DNA damage. D. Induction of DNA cross-linking, interfering with DNA replication. E. Inhibition of release of follicle-stimulating hormone and luteinizing hormone reduction androgen and estrogen. So, what is the primary mechanism of action of anthracyclines like doxorubicin? Answer is C. Generation of free radicals and intercalation into DNA, causing DNA damage. C is the answer. Generation of free radicals and intercalation into DNA, causing DNA damage. And that's all about the questions on chemotherapy. and these are the answers of those multiple choice questions. So if you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.